Is cystoscopy safe? Understanding complications. Imagine peering inside your urinary tract to get a clear picture of what's happening. That's what a cystoscopy does. It's a common procedure used to look inside the bladder and urethra, especially in prostate health and prostate cancer evaluations. The doctor inserts a thin tube called a cystoscope through the urethra into the bladder. This allows them to see if there are any abnormalities, blockages, or signs of disease. Most people find cystoscopy to be safe and straightforward. It's performed regularly and has a low risk of serious problems. However, like any medical procedure, it does carry some potential complications. Understanding these helps patients make informed decisions and know what to watch for afterward. The most common minor issues include discomfort and a burning sensation during urination. Some patients might also experience mild pain in the lower abdomen or urethra for a day or two. These symptoms are usually temporary and resolve on their own. It's also common to see a small amount of blood in the urine after the procedure, especially if a biopsy or other intervention was done. Serious bleeding is rare, but any heavy bleeding should prompt immediate medical attention. Another potential complication is a urinary tract infection. Although not very common, cystoscopy can introduce bacteria into the urinary system. Factors like older age, smoking, or abnormal urinary anatomy can increase this risk. Sometimes, doctors prescribe antibiotics beforehand to help prevent infection. More serious but rare complications include difficulty urinating afterward, known as urinary retention. This might require medical intervention to help the patient urinate normally again. Bladder wall injury or rupture is extremely uncommon but can happen if the cystoscope causes damage. In very rare cases, there can be injury to the kidneys or electrolyte imbalances, such as low sodium levels. If sedation or anesthesia is used, there is a small chance of adverse reactions. Patients should seek medical care if they experience symptoms like inability to urinate, heavy bleeding with clots, severe pain, fever over 101.4 degrees Fahrenheit, chills, or burning that lasts more than 2 days. These signs could indicate complications needing prompt attention. In the context of prostate health, cystoscopy is a valuable diagnostic tool. It helps identify bladder or urethral issues, assess how prostate enlargement affects urination, and guide treatment decisions. The benefits of obtaining accurate information usually outweigh the small risks involved. Proper patient preparation, including possible antibiotic use, can help minimize complications. In summary, cystoscopy is generally a safe procedure with a low chance of serious problems. Mild discomfort, minor bleeding, and infections are the most common issues, but they are usually manageable. Serious complications are rare. Always follow your healthcare provider's instructions and report any unusual symptoms right away. This ensures the procedure remains a helpful and safe part of prostate and urinary health care.